Hi everyone, it's Alexa Linton here, and you're here for the Whole Horse Apprenticeship and our very first webinar for the physical module. And today, for this particular webinar, we're speaking with my friend and colleague, Elisse Miki. Welcome, Elisse. Thanks for being here.
Thanks for having me, Alexa.
Yeah, I'm stoked. So just to give a little background before we get started here, Elisse and I have been collaborating for about, like maybe 8 months now, something like that. We met actually in osteopathy school, and we were introduced by a friend there who's a classmate of mine, and we found ourselves with very similar passions and ways of working, and we first worked together creating a equine craniosacral online course. Initially we were planning on an in-person course, and then it became an online course, and we kind of went from there. So we created with Elisse at the forefront, we created this amazing online course format in craniosacral, and it's like incredibly in depth and amazing. And I saw how talented Elisse was at bringing together information that my very right brain creative self kind of freaks out about. I sort of start to fragment if I try to go there too much. And Elisse is very talented at drawing all that information together. And Elisse, I will turn it over to you. I just want, if you can introduce yourself and sort of what your passions are, what your background is, so people have a bit of a more.
Yeah, that's my second slide.
Oh, is it? Okay, so like maybe
how much I love making
PowerPoint. Get into it. Yeah.
Sharing the presentation right away for you guys.
Yeah. Well, and I wanted to say before you get started that the reason that I, after seeing how incredible the information was that Elisse was putting together when she shared that she was creating this course, manual therapy for horse owners, I was like, oh my gosh, because I had slated myself to create an anatomy course, an equine anatomy course, and I realized that it was going to make my brain explode. And then I started to look through Elisse's work and realize her course is just like incredible, and this would just actually be the perfect thing. So that was kind of how we came to this place, and I'm really excited though. She shared with me that quite a few of you have made like really good progress in her course, and I'm like just so impressed. And yeah, it's awesome, because I know that the anatomy and physiology information is not always like an easy one to kind of get your teeth into. So yeah, so that's so awesome that you're moving through the materials, and I know it might not stick the first time around, but that's why we really wanted to come together tonight and speak with Elisse and kind of hear more about her background, perspective, what she's sharing in this course and how it can be valuable to you and your horses. Because I think when we know that, it helps us to kind of dig in a little bit more when stuff gets a little tricky or complex. And so yeah, that's really what I wanted to do. And also Elisse is just a wealth of knowledge, and some of you have probably heard her podcasts with me as well. So yeah, I really appreciate Elisse, you being here and sharing your wealth of knowledge with us. So thank you. Mm-hmm.
Frozen.
Am I frozen?
There we go. I said thank you for such a warm welcome.
You are so welcome. You are so welcome. So let's why don't we get into it?
Okay, I'm gonna share my screen with you guys.
Welcome, Tanya. I didn't get to say hi, so glad to see you here. All right, so I'm gonna pin your video, Elisse, and oh, that was not what I wanted to do. Just a second. There we go. Okay. Wonderful. Okay, here we go. Take it away, girl.
I can still see everybody on the right. Is that okay?
That's okay. Yeah. I
Yeah.
have it so it's just you. So the recording is just you. Yes.
Okay, that's fine.
Yeah. Perfect.
Okay, so welcome to our webinar. I did look in your guys' course progress reports, and I was really excited to see that so many of you are almost 50% there. Some are even further along, and it just made me so excited that you guys are working through it. And I hope that so far the platform's working okay. It's new to me, so all the feedback is highly appreciated. If anything goes wrong, let me know. What I wanted to do tonight is sort of just go over the main points of the course and talk about some of the things that were not specifically delved into so deeply in the course and the relevance of it to the manual therapy. So a little bit about me. That's me and my horse. Much like probably most of you, I grew up riding. I took riding lessons as a kid, all the way through high school. And I did sort of the traditional, just like English riding lessons and starting to learn to jump and whatnot. And after I graduated high school, I wanted to go to university. And as we know, university is costly. So I had to quit riding at that time. And I was really trying to find a way to get a horse education. But I graduated high school about 25 years ago. And at that time, when I looked around for programs or equine therapy programs, it was pretty much non-existent in Canada. There was a program in the States, but it really didn't look like it was that legitimate at that time. And it didn't seem like I'd be able to get a viable job after that. So I made the difficult decision to do a human bachelor's degree in exercise science and kinesiology. And I was bummed out about that at the time. But after my years in UBC and learning about the human body and specifically like exercise and movement and how that all goes together with training, I did enjoy that education, and I couldn't believe how much I learned. I just like was baffled with the human body, and it kind of started there. I went on to work as a kinesiologist for 10 years, working with sports teams. I worked at the BC Lions and the Whitecaps doing training, and I had just such a cool career with all that. I kind of just went down that whole pathway, and horses were still on the back of my mind, but I felt so far removed from that world that it almost seemed I didn't even know how to get back into it. So I put it on the back burner more, and I just kept studying away. And that's when I decided to go to RMT to get some more manual therapy skills. When I went through RMT, I fell in love with that completely too. I just couldn't believe all the cool things I had learned. And it's a huge piece of what I shared with you guys in the course. So yeah, working through RMT now, the horses were still in the back of my mind, and I just made, the choice one day to just go for a trail ride and just see how it goes. But I was super nervous. It's been like 20 years since I'd been around a horse at that time. And it was like riding a bike. Like I just felt like, how could I have not been doing this for so long? So then I got back into horses. That was about 10 years ago. And then I started noticing all the ways that I wasn't educated when I was younger. And knowing all this stuff about the human body now and how it functions and what happens when injury occurs, it really broke my heart thinking back to when I was a kid and just what we didn't know and things that I didn't understand or that I was being taught that now make no sense, right? So I felt that guilt and just really uncomfortable around it all. And that's kind of when I started to go on this mission of, I need to educate other people. I need to try to teach young kids right off the get-go about the body and anatomy and physiology. So then I went full board equine, and I went and did an equine therapy diploma. I went and did craniosacral and equine osteo. I'm still working through my 3rd and 4th level of equine osteo now, just because I wanted to armor myself with as many equine trainings that I could and really get this information out there. So that's kind of the gist of it. Now I'm fully in the equine rehabilitation business and going strong, and so excited that we have a chance to share this information, especially like this, where it's so easy to get you guys the information in the first place, because that was another barrier for me, is I'm running around seeing one horse at a time, but that's it's not helping the global scale of horses in the world that need help, right? Or body work. So this is exciting. I'm glad that you guys are here, and I'm glad Alexa decided to make this course part of your apprenticeship. I hope that you get what you're seeking out of it. Yeah, I think that's about it. It's like, anything else, Alexa? No? Okay.
No, I think that's great. Other than you are now training to be a human osteo too. So
I am, yeah. I'm doing the two things side by side, and it's a lot of brain power for me.
I know the feeling.
Yeah, it never ends though, right? And this is why you guys are here probably too, is because you're always wanting to learn more. So I don't know if that encourages you or frustrates you to hear that I'm still feeling that way right now too. Just like, oh my God, there's still so much I don't understand or that I don't know.
Yeah.
With all these diplomas and education and experience, it doesn't end. Like, osteopathy is just blown apart my entire insides of like what I used to know and what I don't know, even more specifically.
Yeah. And here I sent Elisse like 40 photos. I've been watching live dissection of a horse. So my brain is blown again. So I don't think that learning ever ends. There's always more. And each horse is so unique too. So yeah.
All right.
Let's get into it.
So yeah, I just put together some basic slides in the beginning here, just like why are we doing this, or why is this important, and why is this part of, right? Like, what's the purpose? Apart from obviously working with injuries and helping our horses feel better when injuries arise, this course specifically, I think I said it in the intro, that I've combined cranial, osteo, my massage, and my kines to try to bring those 4 therapies together so that you guys will get techniques that address multiple systems across the body. So where massage just focuses, mainly on the musculoskeletal, and chiropractic is mainly on the spinal and cranial and so on, I really wanted you guys to get some key tools that address systems across the board, like more globally. And then this is the most important thing for me, and I think Alexa and I have talked about this so many times, that when you start learning how to work with your horse in a manual sort of context, you learn so much about your horse. The relationship just changes. And that's something that I found as soon as I started treating and assessing my horses, that our relationship changed a lot, because you're coming to the relationship with a little bit different intention, right? So I'm excited for you guys to go through that. That's why I put some of the homework in with the palpation. And then, of course, all of the motor control exercises and home care I've given at the end. Not only do they support the work that you're doing, but they really helped build that partnership, because you're spending time with your horse doing mainly enjoyable things. Maybe some of the rehab's not super fun for them, but there's ways to make it fun if you're doing it at liberty and whatnot. So that's a huge piece that I didn't put a whole module into the course, because I wanted to save it for this, to be honest, and to talk about how it's important for your relationship to understand their body, and not only that, but then to try to help them with that. Okay, so as you've probably seen, if you've logged into the online course, there's a whole bunch of modules, and I hope you didn't freak out. You have all the time in the world to do it, okay? I know for myself, when I logged in as a student, it was like a lot of things in my face, but just know that you can download everything. You have the time to take it away with you. There's really no rush. I just wanted to make sure I was thorough. So these are the general contents of the online course. There's a lot of modules on the anatomy and physiology, as you've noticed. There was also the module on intention, which I know Alexa did the webinar for that. And that's something that we're going to talk about a little bit today, and how that relates to the body work that you're doing and that you're going to be learning to do. The terminology I put is a necessity. It really is. So as your horse's owner or your horse's guardian, it does make life a lot easier if you can understand how to communicate these injuries or dysfunctions to the vet in proper terminology. I just found you get a lot better answers if you say, I think it's a muscle stability issue in the right front. There looks like possible tendon issue, right? Just that you're able to verbalize what you see from the horse. Because I think that's a huge piece of some of the puzzle there when we have difficulties getting information from vets, or for vets looking at the things that we're wanting them to look at. So the terminology is key, and that's why it's in there. It sucks sometimes, but it will help you in the long run in terms of communicating. Now, in the Understanding Your Horse module, this one I am really excited for you guys to look at, because this is one of the things that came to light for me when I started working with the horses and started understanding that they were actually talking the whole time to me. I just didn't know that until I took this approach. So I wanted you guys to have this module to prevent you the pain and suffering that I went through with not knowing what my horse is trying to say when I'm palpating certain areas. I think that there was, for myself, a lot of misconnections in our communication because I simply wasn't reciprocating the feedback or understanding the feedback as it was being provided to me through their body. Then as for the techniques, as I said, I really tried to give you some techniques from each sort of category of my personal training, and not just keep it to massage, even though I am an RMT. That's really only a small part of the manual therapy course. And then coming to the end, you guys are going to notice a pretty huge chunk in assessment and reassessment. This is because me being through so many different clinical schoolings, it's been hammered into my brain that you are only as effective as you are able to know what's going on, right? So if you don't assess or you don't try to assess, you don't actually know if what you've done has been effective or not. So it saves a lot of time and a lot of headache if we can cultivate a little bit of a sense of understanding how to approach the situation in the first place. Because when you start learning all these techniques, all this information will be coming at you from the horses because you're going to be so aware of it now. And it becomes overwhelming. Like, what do I assess first? What's more important than what? So the reason I'm hammering this home in the assessment module is for that, to give you guys some guidance there and to have you be able to carry out a really basic physical assessment and have the answers going forward, whether, yeah, I need veterinary care right now, or no, I can do the soft tissue work and then see where we go, or I need imaging. I want you guys to be able to know when to do those things, okay? And then the home care and integration, this is a huge piece too of supporting your horses through life. So the exercises and the integration sort of activities I provided you are things that on a global scale that most of our horses are going to be in need of just because they are domesticated now. Of course, horses living in larger spaces or that are more active or more fit, of course, they're going to be supported a bit better in their own body. But that's not the case for most horses. I was going to say, like, most of us have smaller spaces or we live in the city. So it's hard to keep the horse sort of strong and mobile through life. So I really wanted to provide you with some tools for that as the horses are aging, what you can do to prevent injury and to maintain quality of life, like well into older years. And then lastly, I did provide some sort of basic injury management of the common conditions that you guys will see with your horses. So when injury strikes, I wanted you to have some tools to be able to refer back to. I don't expect that you guys would have made it to that part yet because it's the very last module, but just know that I have included, even treatment plans for you of if you have a muscle strain and it's in the acute stage, these are the techniques you will do. If you have a muscle strain in a chronic stage, these are the techniques you should do. Just to really try to give you, again, that guidance when I don't know what to do, okay? And of course, I'm always here for questions. I'm not sure if the comments, I got a comment, but I'm not sure if the person received my reply, so I'm still figuring out the platform. All right, so what I wanted to do is talk a little bit further on that relationship building piece as far as it relates to the manual work that you're going to be doing. I think that the biggest puzzle piece for me that came together is that the way that humans communicate through touch and horses communicate through touch is very, very different. First of all, we have hands, so humans are touching things, right? When we go to communicate with our horse, it's very natural for us to touch them, but that's not their predominant mode, right? They don't have hands, so they're not walking around palpating each other. They usually communicate through their head and their nose, and they use various body parts. But even right off the bat, it is a different communication style that we're coming in with our hands and they don't simply have hands. So understanding one another becomes difficult because we're kind of speaking these two different languages. And sometimes we forget that they don't actually speak human. They're trying, right? And then that there's some really strong similarities and there's some really strong differences with the horses. So the similarities, I think we've all felt this way, is of course they are intuitive. Of course, they make us feel safe and they make us feel loved. And that's a really human sort of quality, right? And I think that's why we love being with them so much, because they make us feel so good. One of the major differences is that they're really built differently neurologically than us, right down to their brain and the functions in their brain, which is covered in one of your modules. But just on a general note, there are some differences, and it's so important for us to recognize that and also respect that. Alexa, did you want to add? There you are. Did you want to add?
I think that's great. I'm looking forward to, getting more into that as we go along. Yeah.
Okay. I was like, did you want to add anything yet, or are we?
Not yet.
Not yet. Okay. All good. Okay. The next thing I wanted to talk to you guys about was the role of consent. It's not something that we think about so often, maybe with our horses, right? That, do I have consent, or did I ask for consent? But again, coming from the background that I am, consent is one of the most important steps that I have to take in order to get my licensing. Not only that, did I have to go through many, many hoops of completing boundaries and consent courses, passing board exams in boundaries and consent, doing these live interactions where I'm talking through all the stuff with patients to prove that I've gotten my consent. I also have to uphold these boundaries and consent credits every single year. So for a human therapist like myself, this concept of consent is always on the forefront of my brain when I'm working with my human clients. And it occurred to me that I didn't ever think about that with the horses when I was first starting out treating them. I never really got consent in the way that I would have to do with my human clients. And I know Alexa wrote an article on this, and it really spoke to me because it was something that I was feeling already myself. So I just wanted to sort of go over that. Maybe we can talk about this at the end with the question and answer, but just starting you guys now to think about, what does consent look like to you? Do you know if you have consent from your horse? What are the symptoms or the signs and symptoms you'd be looking for, or the feedback that the horse would give you to indicate that you've gotten consent? And what does not consent look like? And then how do we deal with that when it comes to the body work? So I know for myself, it's very frustrating. You want to help, right? And you want to work on the shoulder today. You know that the shoulder needs help. You want to do all these techniques, but the horse is saying otherwise, right? So how do we manage that? What does that look like? And when do we know if we've gotten consent over just sort of wariness about what we're doing? Yes.
Well, I was just having a little giggle about Waco in our last workshop.
Yeah.
And just his great lesson on consent when he was like, I'm done.
Yeah. Yeah. And us to respect that, right? It's frustrating. Here we are. We're trying to teach a workshop and trying to educate all these people on these wonderful things about his cranium. And here he is not consenting, right? It's just it doesn't always strike at the most opportune times when they decide to withdraw consent. I just had it happen today with one of my clients. I also work with brain injury clients, utilizing my horses in equine assisted learning, and the horses were not consenting to working with him today. And that was something that we had to talk about and, discuss how we felt about that and work through that. But I don't make my horses work through things typically, unless it's like a life or death, you know, we have to get on this trailer, we have to get off the road. But when it comes to a therapeutic setting, I 100% honor now the no. Okay. I think that's important. The other thing too, just for you guys to think about, is that if your horse says no to the area that you think is the problem, don't worry. That problem will still be there, maybe, right? Tomorrow. There's always something else you can work on. There really is. This is part of that palpation piece of just going around the body and looking for the signs that the horse gives you where they want you to work. Now, I know it's hard, but it does tend to work out better in the end, right? So if you follow that no and you go work somewhere else that they're really, really excited about it, that they're really into, I found you come back the next day or the next week, and now that shoulder to work on, it's no problem, right? Just that reciprocation of you sort of acknowledging their no seems to go a really long way with them.
Yeah, consent builds trust, just like it does. I mean, we're very similar that way, right? You know, as a human, that when you've been offered the choice of saying yes or no, and then your no is honored, if that's the case, then the trust in the relationship is better for the next time that you know that you're safe to share what you're needing in those moments. So yeah, I think it's such a critical thing to look at. And can I share the little thing that I do, Elise, to get?
Yes. I love it.
So one of the things that I learned way back in equine sport therapy school was I would actually put my hand on the horse's neck before a session. And I still do this every session. And I ask for, I basically picture, we'll talk about intent in a moment, but I sort of show what I'm intending to do. So, you know, okay, palpate and do some massage or whatever it is. And I'll bring that picture up in my mind, and then I'll ask them to give me a strong blink, like a really strong blink, if they're good with that, if it's a yes. And I just wait for that. And sometimes it doesn't come. Sometimes they're like, no, and their eye stays open and they kind of do these little mini blinks, and you can see the tension. And yeah, it's important to listen to that maybe it's not the day for that, or maybe there's something else that you can offer up that feels better for them. Yeah. And I also do this when I ride as well.
Yeah. I really liked yours actually when you shared that. And that's been something I've been doing more of, because I'm finding I'm getting a much clearer yes, which also just makes me feel better about the work that we're doing. Previously, I would just go around and lightly touch areas of the body and watch for the reactions of the horse and see what they had to say about it, if they moved off or if they moved towards. But I really liked Alexa's because it's really simple and clear. And you know when you know that you've received the yes.
Yes, and remember everybody that consent can change at any point of the process. So you may get a nice strong blink at the beginning of a process, but as something goes along and it might not be working for your horse, the consent may leave. And that is okay. So just paying attention as well to the other feedback of ears, tails, tension levels, you might find that, okay, I no longer have consent. Let's go back to the drawing board here. So
yeah, I mean, a really easy exercise you guys can do is just go pick 3 body parts of your horse tomorrow or this week, place your hand on it, and in your head say, do I have consent to work here? And then watch what happens, right?
Really cool.
To get you used to knowing what your horse's yes or no is, right? Yeah, I mean, it's just funny. The more that I think about it now, it actually seems silly to me that this was never taught to us as far as equine therapy goes, because in what world are we allowed to just like throw our hands on someone else and impose these techniques onto them without them having a say, right? It's just
totally
ridiculous, actually. So yeah. I've learned a lot about that in the last few years.
It's a good one. It's so good.
Okay. Next, I wanted to touch on the palpation piece and give you guys a little bit of a pass and just say, you know what, this is going to be hard. Be kind to yourself, because it takes so many years to create these nerve endings in our fingers that actually make us more able to palpate structures. So it's another skill, but it's also a physical skill. So when you spend time palpating, your own fingers develop more neuron buds for sensation. So if you've ever been to a therapist who's been practicing for 20 or 30 years versus going to a new grad or a student therapist, it's not that the student's bad or that they don't know, but you can feel the difference and the wisdom or experience in those hands. But there's a reason for that. It's like that person can actually feel a lot more than someone who just graduated, because it takes a lot of time to build up these nerve endings. I'm sure Alexa can attest to, in osteopathy, just the minute palpations that we're being trained to do. And I'm struggling with that now, because that's the next level of palpating, where you have to dial into motility patterns of organs. It's much harder than just scrubbing across a muscle or strumming a tendon, because those are pretty superficial, right?
Yeah.
So palpation, yeah. It's
I've been like feeling the brain lately. That's a whole other thing.
Yeah.
Yeah.
It's just, it's insane, right?
Mm-hmm.
But when I first started in massage school, just palpating and learning what a muscle felt like versus a ligament versus a tendon versus fascia, even that was like, 5 years of me practicing to finally go, yeah, I think I got it. Yeah, I think that I can decipher these with my eyes closed, right?
Yeah.
So be kind to yourselves. The only way to get better is by doing it. So maybe that's not what you want to hear, but you just have to actually keep doing it. And it does come together. It really, really does. It's been called both an art and a science, which I just love thinking about it that way, because it really is. Some of the greatest therapists in the world, they can palpate anything with their eyes closed and they can tell you exactly what it is they're feeling. It's just amazing to think about. But the science piece is that you, in order to be effective with your palpation, you need to know what you're palpating. So having that anatomy background and being able to visualize the structures that you're on will make it all the difference. Okay. All right. So I think we both wanted to talk a little bit about this piece. So the effect of tension on tissues. And I'm talking about the physiological effect that our intention brings into the treatment setting or into the therapeutic setting. We cover this in the intention module, but I did want to bring sort of to light so that we could talk about this tonight if there were any questions. Just the electromagnetic field and sort of how that works and what I've gathered in working with the horses of the relevance there. So we know that horses are intentional beings. I think that we know that. As prey animals, we know that they've got these heightened senses and that they always have a purpose for their actions, right? There's usually a reason for every movement that they're doing. They have an intention behind their movements. When you watch them in a herd without the interjection of human beings, you can see how easily that they can communicate through intention with just the blink of an eye or even just an energy, right? You can sometimes see one horse move another horse just by standing up a little taller, like really minute, subtle cues. But it's that intention piece of that energy coming out of the horse that the other horse is feeling. So they just live in this field is how I think about it. Like this is so natural to them, right? But it's hard for us sometimes to get on that level because their senses are so much more astute than ours in the first place. Like they're the masters of this, right? But the main key point, sticking to the key points, is that the heart is stronger magnetically than the brain. So what does that mean? It means that previously it was thought that the brain was sort of like the strongest control center in the body, and that it had the strongest electromagnetic field around it. So the electromagnetic field is all the cycling electrons that basically protect organs and let our bodies know if there's negative energies coming into space. They serve as protection in general. So it was previously thought that the brain had the biggest one because it's the brain, right? Like that's the control center for the whole body. But that's kind of been turned upside down with the HeartMath now, and they're putting out more and more research. Like they're really going hard on this because they're finally starting to prove that this is not the case. So the studies that they're doing, the one specifically I'm thinking of, is just that they have hooked people up to ECGs, so measuring brain electromagnetic field activity, and then they've exposed, so they have them hooked up from brain and at the heart, and then they expose them to various images, so happy images, sad images, you know, traumatic images. And what they've found is that the heart actually lights up first on the ECG and then the brain. So what that means is that these emotions are actually starting here and then sending a message up here, which is exactly the reverse of what, you know, old science has said, is that everything starts in the brain and sends a message out to the rest of the body. But then how do you explain these ECGs lighting up, right? Not at the brain. So it's turning everything upside down, basically, and going, what the heck is going on here? But then they've been looking deeper into that, like, why is that? And that's where they've discovered that the electromagnetic field around the heart is actually 60 times bigger than the one around the brain. So it explains why it's able to pick up energy so much quicker and easier than our brain. In short. The other thing that I found fascinating in the studies I've been reading is just that positive emotional states they've been measuring, so like happiness or gratitude, actually create brain waves that are coherent. So the brain waves go very nice and even when the people are told to think gratefulness or appreciation. These are some of the cues that they give the subjects. Versus when they ask the subjects to think of something really awful that happened in their life, something that they're still angry about, the brainwave patterns go in completely chaotic. So what this tells us is that when we're in a negative emotional state, we are lacking in coherence. We truly are actually lacking in proper thinking and brainwaves, because the brainwaves are all over the place. There's no way that logical thoughts are able to go through that. And I think that was it. Yeah. So kind of just bringing it back to why we need to try to think about how we're going to affecting our horses when we're stepping in, because guess what? They're 10 times bigger than us. So think about their heart magnetic field. This is one of the things that I've talked about quite a few times now, because it really, really explains the feeling that we have around them and around their behaviors and around their sensitivity of why they seem to know what's happening 5 kilometers away, or why they know or they can sense sadness at a distance or worry, right? It's just, it totally makes sense knowing this now. And that's why I included the webinar that HeartMath did on the module. It is really long, so you might want to chunk it out. It took me a couple days to watch it because it's really information dense, but it's so interesting, and they go well into the stuff that I'm talking about right now, and tell you a little bit more about around the horse piece, because they're studying specifically humans and horses, as well as humans with horses, as far as electromagnetic fields go. So that's all very fascinating, and I hope you guys get a chance to watch the webinar. So knowing all this, I wanted you to think about where you think emotions start then. When you have an emotion run through your body, where do you feel that? And then what happens next? We'll talk about that at the end. I just want you to start thinking about that. And then lastly, like, how can we create a coherent heart frequency when we're working with our horses? So this is easier said than done. Oh, well, just be positive, right? But what does that look like? And what does that look like to your horse? A really easy one that I've been doing with my clients and my clients' horses and asking them to do is just setting their intention. So whether you believe it or not, you approaching your horse saying, my intention today is to bring, relief to this area. That's my intention. So right there, you're able to change your magnetic field, right? Because we already know that when we bring positive emotional states, or we send appreciation and gratitude. So if we are appreciating our horse and saying we want to help them, we already know that our brain waves are going to go like this. So we've set those wheels in motion. Okay. So I think that's really just the easiest way, and don't second guess yourself. I know so many times people go, oh, I set my intention, but I don't know if it worked. I say, stop. It worked. Don't second guess yourself. You have to just get used to believing that this is actually possible, and then you'll start to see this out playing with the horses, and it's just like mind-blowing.
Mm.
Did you have anything to add to that?
I don't know.
No? Sorry, it's your favorite subject.
But I can't wait to get into fascia.
Oh, right. Sorry. I know you guys are studying fascia this week, so I brought some cool information for you. Okay. So in the course, getting back to the course, I added the different techniques so that you would be able to access the different systems of the body. Like I said before, the massage going into the muscular system primarily. I've given you some neuromuscular techniques because you can't really like massage nerves that are stuck in muscles and fascia. So massage isn't going to be the best possible scenario for a neurological dysfunction all the time. So I wanted to give you some neuromuscular techniques where you can access large bundles of nerves in a different way. I also included the joint techniques because, again, massage is great for muscle tissues, but not so great for joints because joints are made of different tissues, right? They do different things. They've got a different function. They also have different techniques that go with stimulating healing in those structures. And then, of course, the motor control and activation exercises, which is just that supporting the horse for life. Here we go. Then I included some myofascial fascial techniques. And what I want you guys to think about is that fascia, you've probably already learned this, is everywhere. It's our bodysuit. It goes from head to toe. It goes around, through, between, everything. So the fascial techniques are actually the conduit for all the tissues because they touch every single tissue of all these above, right? So the fascial techniques, I would say, pay close attention to because you can get some pretty profound responses from very minimal work. This is I just wanted to enlarge it for you guys. You've probably seen this all. This is just a muscle fiber sort of really, really, really enlarged. And you can see between here, this web, that's the fascia. So it kind of looks like a spider web. So that's fascia that's between those fibers, but it is also going around it too. It's kind of glistening here if you look close. And then what I did further was enlarged that. So this is this. And the most important piece of this photo is that you can see those tubules coming off of it. Those tubules are what gives the fascia the structure that it has and make it be able to balance tension and integrity and like be super strong. But it's movable but super strong. The reason it can do that is because those tubules are actually able to slide along these axes. But if an injury happens or dysfunction has occurred or disease, and this becomes hard or lacking in water, this can not be able to slide. And that's where we get what we would think of as like fascial adhesions or fascial restrictions. Once that happens, then we may need some intervention, such as the therapeutic techniques, to be able to restore that ability of that to slide down so that when something compresses the body, that those tubules can all slide, right? And they can do their job of supporting the structures. I wanted also, this is really funny, the YouTube I'm about to show you, but the sweater man analogy, you've probably seen this before if you've looked into fascia. That's just the sort of very basic visual for you about this bodysuit that goes around and through and between everything, and showing you about that if you pull, right, at one corner of this sweater, look at the lines of tension that are now changing through the body, right? So something up in the shoulder, we can see that there's a line of tension here through the abdominals, right? There's a line of tension across the opposite shoulder. There's a line of tension going up through the side of the neck. So it's really easy visual to sort of give you that idea of why sometimes when you hurt something up here, that the problem shows up at a much more distant site than you thought. Another interesting fact that is good to know is that fascia doesn't show up on MRIs, CT scans, or X-rays. Very unfortunate, because that's what's utilized when we're diagnosing things and when we're treating things. But with the fascial system now being understood to have its entire own neurological network, And it is now been given the category of having its own system. It didn't used to be called its own system. It wasn't recognized before. So if you look in older textbooks, there won't be a fascial system chapter. Now, in current textbooks that are coming out now, there are, because they finally recognize there's this whole system that we actually weren't even taking into consideration when we were cutting people open and doing surgeries and whatnot. But what's I want you guys to think about is, if this doesn't show up on these imaging, yet it's an entire system that covers and goes through our entire body, how good do we feel about making a treatment decision with a huge chunk of missing information, right? This is a huge piece of the puzzle that we're just kind of like ignoring because it doesn't show up, but we know that it goes around everything. So I want you to watch this YouTube. I've got it queued up just for a couple minutes, where it's another therapist, a structural therapist. She demonstrates this exact phenomenon on a live man he's wearing a sweater suit. But it's really cool to watch what happens when she gives a adhesion. So I just switched to
the other video.
Yeah, I'm just going to share that now.
Perfect.
Can you see it? Alexa, can you see it?
Yeah, totally. Yeah.
Okay. So here she's just explained what I just explained to you about the tubules and the interconnectedness of the fascia. And now she's going to introduce the sweater man. Uh-oh.
So the good news is that fascia can give.
I might get an ad here.
What?
I am totally freaking out.
There we go.
Right now, I'm going to give you that visual demonstration that I promised in order to make sense of all of this, so you can understand how it's affecting you right now. So allow me to introduce my colleague, Cody Williams, who is a structural therapist at Sterling Structural Therapy. But today, good, please giggle and whistle, for the love of, yes, good. So today, Cody is Monsieur Fascia, okay? And I'm going to torture him and give him all sorts of fascial restrictions. Now, before I do, Cody's fascia suit is healthy. And notice the cobwebs, right? They're doing well, right? So he can lift his arms, he can move, he can go hike, he can go play tennis, he can do it, he can tie his shoes, no pain, okay? No problem. I'm about to change that. So I'm gonna give Cody a myofascial restriction at his right rib cage and armpit. And if you can already see, he's already having to adapt a little bit against this. Good. So now, Cody, go ahead and try to lift both arms up for me. And we're gonna just, woo, good. Okay, so can you see that his range of motion is restricted right now? Really try to lift them up higher, Cody. Okay, now drop them back down, because ow, that's not fun. Now, this makes sense, right? You can imagine how this is gonna create this restriction. Did you notice what happened at his left shoulder over here? Yeah, so go ahead, lift both of them again. A fascial restriction here is causing some serious range of motion issues over here. Now let's drop that down, and I'm gonna give him a fascial release and fix him up, and now, woohoo, yeah. Did you notice him kind of move his neck? It's not comfortable in the neck either. Just gonna give you a brief example. A client that came to see us, fully torn rotator cuff. The surgeon said, sorry, can't repair it, fully torn. She now has that full range of motion and no more pain, because we actually helped her modify her fascial restriction, and she changed certain habits to not recreate it. So it's actually incredibly adaptive. Okay, your body is incredibly adaptive. It does not rely on just one small little muscle in there, or even 4 little rotator cuff muscles, if you create balance elsewhere. I'm going to give another example, torture Cody some more. And this is a bit more of a complex example. So I'm going to give Cody a pretty severe myofascial restriction at his right hip. Good. Now, first of all, can you see how Cody has started to kind of develop some interesting posture? Good. Cody, try to lift your arms for me, please. See where the restriction is? It's even worse than before, by the way. Did you notice that? And then drop the arms back down. Now, Cody's gonna attempt to walk with this myofascial restriction. So we're gonna go for a little walk, and he's gonna walk a little bit interestingly, right? Okay, and we're gonna back it up so we don't fall on Dr. Rob. Good. okay? So what I want you to see is that, first of all, you already saw how this affects his shoulders. Think about his neck. Can you imagine what might be happening at this hip over here? How that might be compensating and actually wearing on things, maybe even wearing cartilage from the position. Of course, this hip is probably not very happy, and this knee could have serious problems. With this pattern, Cody can have plantar fasciitis on his left foot,
Okay.
because it has to deal with severe loads and modified impact with every step to try to stabilize him.
Okay. So I'm going to pause there just because I think you get the gist of that. And I'm going to stop that share. Share again. Okay. So I just love that because it's really easy visual to understand. And now I want you to think about the horses and how big they are and how susceptible they are to injuries, right? They're horses. They run into things. They live in herds sometimes and kick each other. So it's really not a big stretch that this, of course, is going to affect them, maybe even on a larger scale, because they don't get to go lay down like us, right? When we're in pain, take the day off, I'm going to stay in bed. They don't have those options a lot of times. So things start to pile up. Almost there. I'm sorry.
Here we thought that we would have so much time left over.
I was like, we're not going to have enough information for them.
It never works like that.
No. So the role of fascia, it's enormous. The main ones that I want you to think about in our course is just that it's the connection point of all the systems. So when you look at your anatomy and physiology modules, remembering in the back of your mind that all those systems are actually connected by the fascia, okay? So we can directly influence all the systems if we understand the use of those techniques too. Other thing is fun to know is fascia has its own nerve endings, so it can actually relay its own information to our brain. I think, Alexa, you've talked about that it can store memories, it can remember pain impulses, right? So there's no wonder too why we get this sort of repetitive pain cycle if there's been an injury.
Often stores trauma as well, trauma and emotion. Yeah.
And you've had some pretty profound results restoring trauma, right? Like releasing trauma and then having that tissue physiological change.
Yeah. And very immediate often. Yeah.
Yeah.
Cool.
And another big role of the fascia is that it forms these things called myofascial slings in the body. So when you get to your fascial lecture and your brain is exploding with all the myofascial lines of the horse, no, I don't expect you to memorize that or know them all.
Neither Elisse or I do.
No. But it's important to see how many that they have. Mm-hmm. And if you understand what a sling does, you're going to understand why one injury to the hock could wreak havoc through the chain. The role of slings is that they're on top of our fascia being everywhere through and around and above. Slings are these extra parts of fascia that kind of compartmentalize different muscle groups. So they go around certain muscle groups on opposite sides of the body to create like cross stability, anterior stability, posterior stability. If you ever think about like pitchers and stuff, if you watch when they're throwing a ball, you're going to see this cross of the body motion. It's those posterior sling is winding up, and then it can create much more force, right? Because you've got this huge myofascial sling, almost like an elastic band, helping those muscles. So I've just given you some examples in the human body so you can start visualizing that muscle groups on their own aren't what's doing all the movement. It's these slings as well that are through the muscle groups, attaching them to each other. This one is a big one for humans, that a lot of injuries happen, and that sometimes it's up here, but you'll have an effect way down here because it's crossing the whole body and holding all those posterior diagonal muscles together.
Totally.
Mm-hmm. And then I just wanted to show you the cross comparison so you can see the horse and the human and make sense of what I'm trying to say here. So these are the main ones in humans. There's more. There's like 16 in humans too, but these are the main ones. And what I find fascinating is that the horses actually have the same ones as us. So there's a lateral line. This kind of holds everything down the side of our bodies up. We see this lovely pink lateral line on them. Same idea. So that's supporting them laterally on the outsides of their body. You've got the spiral line in us, it's crossing over. This is the headache one in horses because it crosses over 3 times in them. I think this is due to their size and that the contents that are in their abdominals is much larger than us, right? the superficial back. So this one's coming down the back and down the back of the legs. I can't see it because my face is covering it, but in the horses, it's coming down. It's that green one. Yeah.
Yep.
And it kind of splits off, right? So they've got this back line too that's kind of holding everything in the back sling together.
Yep.
And then the superficial front line, and them is the superficial ventral line, coming down in blue here. So yeah, you don't need to know these all, but I think it's really cool to recognize this is one of the similarities we share with them, is that we've got these slings in our body. And if you've ever injured something, you will have felt the effects of these slings, because you're going to get pains or discomfort sites very far from the source, right? Same thing for them. And it's important to recognize that sometimes where you saw the injury, this happens all the time. Well, the flexor tendon tore. Well, yes, that's accurate, but there's possibly going to be opposite hip problems now too, right? Because of these lines. Just keeping an open mind. Okay. That's it. That's just another review of what it was in the online course that we already talked about. And then I just wanted to finish off by letting you know that there is, of course, the live course as well that we offer alongside the online course. So I just did that this last week, and it was really great to, have the participants go through the online course and then actually come and do the 4 days of the one-to-one instruction, going through every single technique. And we also spent a lot of time on the assessment, because that's the piece that most people struggle with. It's just sort of like putting this all information together into a cohesive plan, right? Once you've learned how to assess. So just letting you guys know that schedule will be going up in about a month or so on my website. And if you guys, since you're already registered in the course, you would get $250 off because you're already doing the online course. Okay?
Yay.
Or did you know? Yeah.
I'm here. Christiane
Okay.
says, can't wait for the border to reopen. Totally.
What's that?
Christiane says, can't wait for the border to reopen.
I know. Yeah. Everyone that we had was local that came last week. Yeah. Thank goodness. That could drive in.
Totally. Soon, everybody.
Soon. I think January. Is that what we're thinking now?
Ugh, yeah, I hope so.
Yeah.
I hope so. So that, yeah.
You want me to
Brittany is helpful. Thank you, Brittany. I was trying to look it up. So Courtney asked they're not two lateral lines. She meant the red line was the lateral line. So yes, there are two, one on each side from head to tail. The pink line was an arm line. Yeah. Thank you, Brittany. That's great. Yes, the border is very close, Courtney, unfortunately. Awesome. Thank you, Elise. That's so great.
Yes, thank you.
And yeah, I know that the course, it looked like it was such a success. So, and it's, it
went really well. I'm so pumped because I can't believe how many horse owners there are that really want to learn all this stuff. I just love it. I'm like, yes, finally, right?
Totally. Yeah, for sure. It's so exciting.
Yeah.
That's so awesome. And for, I know a lot of you live further away, but the hands-on part is very invaluable. So, to get your paws on a horse and feel and learn the palpation, that can be so huge. Take the theory into something really practical. So yeah, I love that that's available. Awesome. So let's anything else, Elise? Can we open up for questions?
No, let's do questions. I feel bad it was so long.
Oh no, it's great. It's great. We're all still up and we've got different time zones going on around here.
Oh no.
All over. No, it's all good. I think Dominique, it's morning time. And there's a few that are probably in their PJs already, I'm guessing. Yeah. And yeah. So no, it's great. We've got people from all over. I think if Lima's still here, she's here from Latvia, but I think she came for a little bit, but it was 4 a.m. for her. So.
Oh my goodness.
Yeah. So she was on, but she probably fell asleep. So yeah. Okay. So does anybody have some questions? I know there was one from Lily. I'm going to just track back. Lily was wondering if the joint techniques are safe on her mare who has an arthritic joint, she's got a golf ball size arthritic growth on her fetlock right at the moment. Are those techniques safe for her?
Where exactly is the growth? like in the joint or on the outside of the joint?
I'm gonna unmute you though. You got
Oh.
it?
It's both in the joint and on the outside. It's not good. And we've done a lot of work on it. It's actually like shrinking a little bit. For like my hippie voodoo stuff that I do on it. But yeah, it's both in the joint and then also on the outside. It looks like a tumor.
Okay, and is it restricting movement completely, or is there still a bit of sliding glide at the joint?
There's still movement. Like a surprising amount of movement for.
Okay, yeah. No, so the joint techniques are exactly for this type of stuff where you want to maintain the joint nutrition as much as you can because you know it's compromised right now, right? We know there's a growth in there. That's great that you have an imaging to go off of, right? So the passive range of motion, you're always staying within the barrier. So you're never going to force the joint out, but the purpose of it is to stimulate joint lubrication so that she'll get fluid inside there, which carries nutrients. If they don't get the nutrients, then that's when we start to get calcification. So it's really important to try to do a little bit of movement, very gentle, staying in barriers. So what I mean by staying in barriers, you're not forcing it where it can't go. You're taking it where it can go and like oscillating basically.
Okay.
I would do that every day. I did that with my ringbone horse, and that really helped get him through it, right? Just because he still had fluid going in there. So that would be, yeah, absolutely safe. But I was going to say not safe if it's actually fusing the joint or not allowing it to move.
Okay, cool. Thank you.
You're welcome.
Christian asks, will the joint technique help prevent arthritis?
Yes. So that's like the predominant use is like we don't even want the problem to start in the first place. And if you haven't got to joints yet and know why that's happened or why that happens, it's because fluid is only produced inside joints via friction. So that either means by movement or by us inducing a movement. So if a joint stays static, no lubrication can be made. It needs friction to make it. So that's why I'm so adamant that if you have a horse with arthritis or has been on stall rest, that you need to get them moving, either walking them or getting in there and trying to oscillate the joints so that the fluids can start being made. Otherwise the joint tissue, it starts to degenerate. And then you get like osteoarthritis or ring bone.
Yeah. What would you do? Kirsten asks, what would you do if it is calcifying? So same thing.
So if it is calcifying, once it can't slide and glide, then you're going to move to just supporting it till it fuses, right? But while it's still sliding and glide, I still did it above and below the joints to maintain the rest of the limb, right?
Yeah, and I've been working with that with Raven too, and it's been really, really helpful. Yeah, because I think initially I was like, I don't want to move her. I don't want to
No.
But I'm like, no, she's got to move. She's got to
joint need friction.
She needs that pumping through the feet and so yeah.
Yeah, I mean, in human training, that's like with anyone with arthritis, we're forced to do. It's like you gotta do this because it's the only thing that's going to keep that fluid going in there, which brings the nutrients. Like no nutrition to the joint equals, right?
Yeah, and obviously there's a lot of other pieces, and we're going to get into that. Raven's been teaching me a lot about this, so, and I know there's a lot of horses in our crew that are needing that support this way, lots of joint things going on. So yeah, I'm excited for you all to see these techniques and then be able to, work with this in different ways. And then we can continue that through the nutrition, hoof balance, as we go along. Yeah. Jessica asked, is there anything that can be done in the neck for neck arthritis? So in the vertebrae.
Yes, same idea. It's a little bit harder to oscillate vertebrae if you're not trained to. So active range of motion would get the joint fluids going. So carrot stretches, depending which direction is the restriction. I mean, I would just do them all just to be safe, but like side to side, up, down through the legs.
Yeah.
What's that?
The headlamp.
I'm like, I think she needs to go.
That's funny. I love that Marnie says motion is lotion. I'm gonna totally.
It's true. It's so true. I mean, we're just talking about joints, but the same goes for the fascia, right? The sliding glide. Like you don't slide and glide, there's no water in there. And then you saw the droplets and stuff. It makes sense why things get dehydrated.
Totally.
Right?
I was actually just listening on the dissection today. There's a vet that's helping with it, and he said they did a study on 3 sets of foals. One set that was in like in outside all the time and moving all the time. One set that was inside most of the time, and one set that was inside and then went outside and ran for like 10 minutes a couple times a day.
Yeah.
And he said that the ones that were the best, guess.
I mean,
outside and moving all the time.
Yeah, I think I know the answer. I don't want to.
Yeah.
Yeah.
Yeah. But he also said that the worst were actually the ones that were in the stall and then only went out for, 10 to 20 minutes a day and ran at those.
Right. Some people think, oh, but that's good. They're running, but that's actually because it's really hard on the joint and then nothing.
Yeah.
Right.
Yeah. So it's interesting to think because oftentimes
yeah.
horses are doing that, standing around in their paddock all day and then, a big burst of energy. So we really have to remember that. Lisa's exercises are so good in terms of warming up and home care and like really thinking about the joints when we're working with our horses. Yeah. Awesome. Oh, Jessica said he just came in from feeding the horses, so he had his headlamp on.
Oh.
That's awesome.
It did look like a police officer coming up from behind.
I thought that's what you're thinking.
Yeah.
Courtney asks, is there any advice on tendons that have scarred over from injury? That this particular injury was a tendon getting cut most of the way through.
Yes. So actually there's a couple tendon techniques specifically in there, which are for scar tissue and for exactly that type of sort of issue. It's the C-bowing and the S-bowing techniques when you get to them. If you have a scar, like if you have a palpable scar, I would just make sure that I focus the technique near to the scar to start, not right on it because you don't want to like rip up too much if it's really, really tender, but I would start just above that scar and do the C-bowing and S-bowing. Let the horse have a day off, go check it again. And if it's okay, then work your way closer to the scar. And then eventually you can break up the scar a little bit, right?
Yeah.
Yeah, that would be really helpful.
Yeah, she says it's 8 to 10 years old, so it's chronic.
Oh, perfect. So well into chronic, so you don't have to worry about it being in acute inflammation right now. Just be aware that if you do the scar tissue techniques, like the C-bowing and the S-bowing, you will cause a little bit of inflammation. So you want to give the horse the day off the next day if you're working them. Right. Sorry. You're like, yeah, just because these techniques are breaking up tissue, which is good because we want scar tissue broken up, but it also creates an inflammatory response that we're, doing this on purpose. So you still want to give that 24-hour sort of rest between it and recheck it.
Awesome. Okay, any other questions before we sign off here tonight? Oh, here we go. Is there anything that can be done when a tendon sheath rolls up? And the vet said it will not affect soundness.
Like the whole sheath has detached, or what does she mean by
you can unmute yourself, Jess.
No, he has it's like a bump that I noticed. It's on his leg, right on like the inside of his hock. And he, the vet checked it out, said it's not a big deal. Just sometimes like the tendon sheath kind of like rolls up, and that it's not anything bad. But
it's not affecting movement at this point.
No.
Is there is the tenderness in the area? If you push around on it, does the horse step off or anything?
He doesn't care.
No? Okay, that's good. What I would do is just maintain the tendon. Then, like, you're not going to be able to reattach the tendon sheath, obviously, right? But you want to prevent it from balling up or in wherever it is, right? So just what we're saying about the scar tissue and stuff, you want the two wheels to still be able to move. Even if they're moving weird, we want mobility either way. So you would still be doing tendon techniques there, right? Not so aggressively because it's not rock hard, but sort of like on a maintenance level. Okay? Just so it doesn't harden.
Yeah, we like blood flow around here and like so
yeah, because if it's kind of similar. This happens in humans around the biceps tendon a lot of time. It will kind of rip off. Then you get this like half of a ball down at the bicep, and it doesn't cause major issues unless the person stops using their shoulder for like 6 weeks, and then it starts to turn into rock hard scar tissue, and then they're like, I can't move my shoulder. So that's sort of what I'm saying. I try to prevent that by keeping the movement going.
Yeah. Christiane asked, can she do this technique on herself? She's has 2 surgeries on her elbow and lots of scar tissue. So more of like a hyper.
Yeah, like the bowing and stuff.
Yeah.
If you can, it'd be just kind of hard, right? To sit, you'd have to turn your elbow on. Maybe you could get some assistance though. Yeah. Yeah. These are human derived techniques, right? So
yeah. Brittany has a question about her mare Perletta, but she's quite a complicated case, so it might be interesting. Brittany, why don't you just ask and we'll see.
Okay. So Alexa's actually worked with her a few times remotely, and has helped tremendously. And I just took a fascial lines class this last weekend, and I noticed a huge difference on, she of course colicked the night that I took the fascial lines class, and I used the deep ventral line release point, and it actually made a huge difference. She went from being in acute pain to not, in all of 30 seconds to a minute. I still gave her Banamine because I was paranoid, but I'm really impressed with how much it did release. And then I noticed since then, like as she's walking up the hill, that she actually she's moving more through her whole hind end, and I haven't done any more lines on her. But to give some context, she did the splits last, I guess it's been a year, over a year now, in February, during the snowstorm. We had a huge snowstorm, and she did the splits. It completely ripped the muscle. It ripped
Yeah, okay. Yeah.
Her left leg primarily went out, and she tried to catch herself with it, and it ended up, it was an original injury that was really bad, and then it got worse because we were stuck in the stall for 2 weeks while the snow melted, and I didn't want to let her out. And then she was trying to like figure out how to be comfortable, and when she laid down, she got up and slid, re-injured, and then like 3 weeks later got pissed about being in the stall, kicked the wall, re-injured. So it wasn't like one single injury, it was a whole slew of
I know, and that's exactly what happens, right? It's like one thing leads to 10 things, and now it's this nightmare. Like, where do I start, right?
Exactly, and it's right in her bicep femoris, and then also semimembranosus, like right below. It includes semitendinosus, and then right at the attachment of semimembranosus. And so literally her butt, instead of being like the nice smooth curve down into the hock where it goes convex to concave, it just doesn't. It goes convex, and then it completely drops in for about 1.5 inches, and then it goes back to like having the normal muscle and being down below. So there's a literal separation and scar tissue internally because of that. I've done a lot of work with the external scar tissue, but her hind end, when she walks, walk normally with this foot, but with this foot, she has the full swing phase, and then it's like it catches on the scar tissue, and she like slaps her leg down, and then it swings, and then it catches, and she slaps her leg down. So I'm not sure with the location of the scar tissue if there's like, I know I need to do more.
Can you feel scar tissue when you go inside, like inner, like can you feel lumps and bumps all the way down?
Not all the way down, but more medial laterally.
And is it right up by her pubic bone, or is it closer to the rear?
It's closer to rear, but honestly, there is some in the pubic bone, and I'm sure because she's a quarter horse and she's got that booty, I'm sure there's more that I cannot feel. Like she's also a little overweight currently because of all of these injuries, so she's got a little extra chunk.
Well, it's hard, right? Because now she's all this stall rest, lack of movement, like. It starts to pile up.
She's had foot issues because of it. She has all 4 feet are in glue-on shoes currently because her feet got torn to crap during this whole process, and it's just like one thing after another. She got double barrel kicked by my other mare and actually needed like.
She really has the worst luck.
Really terrible.
So just in terms of just, keeping things more succinct, do you have what would be your specific question?
Sorry, yes, I got really distracted. Is there, I mean, we were talking about, I know like more superficial scar techniques, and with the S bowing and the C bowing, that's more on tendons.
Yeah.
Is there something that I can do that gets deeper that would also help with her range of motion, but also like get to what I can't?
Yeah.
touch?
Two things are coming to mind when you were talking about what's happened. The first one, as far as the techniques, one of them is in the course, so it would be the shearing technique. Based on where you're describing the injury, I might come in like, so you're gonna, if this is her butt, you're gonna put your hand medial around the butt. This is where I don't know how athletic you're gonna be able to be, but if you are in any way able to extend her leg and hold it up while you're shearing, then you've slackened off some of the tissue and you could get a little bit deeper into the scar tissue. Shearing, it doesn't sound deep. It is though. It's because of the sink down and then the fact you gotta just hold, okay? It's gonna take a while with that amount of scar tissue. I would go indirect because of what you're describing. So meaning you're gonna go into ease, okay? And you're gonna be there for a long time. So that's one thing. If you can hold her leg into extension, that will make you able to get more slack in the fibers, right? If it's too heavy, I understand that. The second technique that's coming to my mind, it isn't in your course, but it's very, very simple to do. It's called a counter strain technique. What you can do is you basically bring wherever the scar tissue is, you're going to try to slacken it by bringing her leg into ease, right? So into, I would say, extension by what you're saying, maybe adduction. So extend, adduct, hold. Okay, so you're basically, counter strain is that you're letting the tissues try to unwind themselves without any manual manipulation. Counter strain techniques are great, but they do require like 3 to 5 minutes. So I don't know how your ability is around, if she yanks the leg back, she yanks the leg back, go again. But what you're trying to do is find a point where that tissue the scar tissue is floating. So there's no tension on any side. So you got to figure it out, right? Maybe palpate and see where it's floating. That makes sense?
That makes total sense. And actually, originally when I would scratch her tummy and her udder, she would lift her good leg up and stand on her injured leg. But we finally have gotten to the point during this COVID thing where she feels confident actually stretching that other leg up. So I think I might be able to do like an itch hold.
You know, you have to be creative, and this is it, right? You just got to figure out some way, but just keep in mind your goal is to slacken off the scar tissue. So if it's taut, you're going the wrong way. So go whatever way that means, right? Okay.
That makes so much sense. Thank you so much.
Good luck. That's a lot, though.
Hey, you got this, Brittany.
Thank you.
Awesome. Okay, that is so great. Thank you, Elisse.
You're welcome.
I've learned a ton. I hope you all have learned a lot tonight. I know we went a little over time here.
We did over time.
You know, yeah, our inner geeks are all happy. So thank you, Elisse. And I'm gonna stop the recording now for those who are listening into the replay.